Somewhere in North Central Florida, an older African-American woman is on Medicare. She pays over $200 a month in premiums, money she stretches carefully.
What she doesn't know is that she qualifies for the Medicare Savings Program, a federal benefit that would cover that cost entirely. She's not alone. Across the country, 6 million Americans are eligible for the Medicare Savings Program and not enrolled.
Among Black Medicare beneficiaries, enrollment sits between 43 and 57%, even though a quarter of them live on incomes below $20,000 a year.
This isn't a hidden problem. The benefit exists. The people who need it are known. What's broken is the path between them.
The challenge isn't that eligible people can't be found. It's that finding someone is only the beginning. A community health worker identifies an eligible senior at a health event on Monday. By Wednesday, life gets in the way. Documents are unclear. The follow-up falls through.
Community health worker programs face real operational pressures, workforce turnover, continuous training needs, and the burden of coordinating care. Across dozens of members without the infrastructure to hold it all together.
This is a public benefit delivery problem, and it's the problem we're building to solve. In North Central Florida, 2 nationally recognized programs are already doing the work. UF Health Street, a government-funded, award-winning community engagement program, has 15,000 registered community members across 9 counties. Their trained community health workers conduct free health needs assessments at health fairs, senior centers, and community events, connecting people to medical and social services. It's a model of community trust built over more than a decade. SHINE, Florida's Medicare counseling program, operated locally by Elder Options, deploys trained volunteer counselors to many of the same venues: senior centers, churches, civic groups, health events. They offer free one-on-one MSP application support and Medicare counseling to the same population.
Both programs serve the same people. Both show up at the same health events, but they operate in separate workflows. No shared case visibility, no coordinated handoffs, no way to confirm that the person identified actually made it to a SHINE appointment.
The bridge between them doesn't exist yet. That's what we're building.
The CHW EmPowered Platform brings together 2 AI systems, Daphne and Reggie, within a unified case management infrastructure, purpose-built to close that gap.
Daphne functions as an AI note-taker and decision support tool for the CHW. During a health needs assessment, Daphne listens to the conversation between the CHW and community member, capturing health-related social needs and signals relevant to MSP eligibility, such as insurance coverage and income range. When the conversation ends, Daphne produces a structured summary for the CHW to review, a snapshot of the member's needs, an eligibility flag, and recommended referrals to community resources.
The CHW reviews, confirms, and acts. Daphne isn't talking to the senior. It's making the CHW more effective.
Reggie keeps every party in the workflow connected. Reminder calls to community members, caregivers, community health workers, and counselor to help them gather documents and prepare for their SHINE appointment. Reminders to SHINE counselors when a referral is pending. Follow-up to CHWs on open cases. All in a culturally concordant voice developed through our NIH-funded eReach project. The CHW dashboard gives workers a real-time view of every member's status, who is progressing, who has gone quiet, and exactly where a human touch is needed most.
We designed this with a clear principle. We are not putting a chatbot in front of a 70-year-old. The community health worker is the relationship. Daphne and Reggie make sure that relationship doesn't get lost in the gaps. Daphne recommends CHWs act. Reggie coordinates. People decide. Human oversight at every step.
This is what it looks like to use AI to address structural barriers in public benefits delivery, not replacing the trust that makes this work, but building the infrastructure to sustain it. Benton Technologies is a digital health equity company building AI infrastructure for underserved communities. Our partner, Health Street, brings the community trust, the CHW workforce, and over a decade of implementation experience. Dr. Emery Sezgin at Nationwide Children's Hospital brings Daphne, an AI system with demonstrated feasibility in community screening. Together, over 24 months, we will pilot this platform and generate the evidence that AI-assisted delivery can move enrollment numbers where manual outreach alone cannot. We're building the bridge.